This is your Houston chiropractor, Dr. Gregory Johnson. We have Vicki here with us this afternoon. And Vicki came in to see us from watching our YouTube videos, right?
Correct.
Yeah, so she came in with the same problems that you saw and you see every day on our YouTube channel, because what you see on our YouTube channel is exactly what you get when you come here, right?
Correct.
Would you say that's accurate?
That's accurate.
Okay, so what we're going to do, Vicki's had some lower back and SI joint misalignments that's caused some ridiculous pain down her legs, including numbness and tingling and cramping down into her calves. And she's had a little bit of neck pain and tightness up here. But the main thing is she's had some headaches and dizziness, and also even some blockage in her ears where they feel full, right? And some ringing in your ears too. And that all comes from the atlas occiput articulation and the nerves coming right out of C1 and occiput and surrounding the medulla oblongata, which is the brainstem. So we're going to show you how we treat that today. Let's have you close your eyes for me, Vicki, and flex your head forward and backwards, please. So in her posture, you can see her head's a little bit forward and a little bit to the left of center. Not bad though, not near as bad as it was the first time I saw her. She's got a little bit of an increased curve in her upper back, which is kyphosis, but that's from her head being forward. Her pelvis is shifted a little bit to the left of center. It's also elevated a little bit on the left side. That's a positive theta Z pelvis and a positive SX pelvis. And that means she's got a little bit of a curvature right between where her mid-back and lower back meet. So first thing we're going to do is we're going to decompress Vicki.
Okay.
This is for all you crack addicts out there. She's a noisy one. We got lots of good sound effects with Vicki. Now, people don't come here just to get on YouTube, but what you see us doing here on every video is what you will get when you come in here. And that's what brought you here, right?
Yes.
Because you've been to other chiropractors before.
I have.
Is this different than other chiropractors?
It is so very different.
I'll let you tell them that after we get done here, because
Okay.
I don't know if they heard you. I was noisy. They always tell me to be quiet so they can hear everything. All right. Now, let's have you take a nice deep breath through your nose, hon. Let it all the way out. Excellent. Boy.
Oh.
Ring dinger.
Ring dinger.
Yep, she's still kicking, though. Okay, now, remember we talked about her occiput and atlas articulation, so I am going to adjust her atlas right there and there. Perfect.
Wow.
Good job. Boy, that was a heavy duty one.
Yes.
Now, you felt that move higher today, didn't you?
I did.
Yep.
Yes.
And I focused in on your atlas and occiput so we can get that nerve freed up to your brain.
Oh.
Okay, let's help you up sideways, and let's come over here on your tummy next. Change this so it don't look like the thing shade makeup. There we go. And yes, I did not make it. Alright, now the left leg is coming up about 1/4 of an inch short. When I bring her legs up, that tightens up in your lower back right there, doesn't it,
Yes.
Vicki, and her thighs.
Yes.
And her legs get even, so that tells me that she has a sacroiliac subluxation or misalignment right there. That little tender touch.
Yes.
And that's where she's been getting most of the pain down her leg and into her calf. And the cramping in her calves. So we want to free up the sciatic nerve, which comes out of the sacroiliac region. Most people think the sciatic nerve's only out of the lumbar spine region, but the majority of it's actually out of the sacrum and the sacroiliac region. So I'm adjusting her sacrum on both sides and then straight down the middle, superior to inferior, both SI joints. And I haven't even touched her lumbar spine yet. I wanted to show you the difference, and now it's exactly even, and I bet you this already feels a little easier than the first one.
Oh, yeah.
Yep.
Wow.
And now we're going to move up to L5, L5 articulates with the sacrum, which is called the lumbosacral joint. L5, S1. There's L4, L3, L2, and all the way up to L1. You notice the arms angles change as I do these. There we go, good. Okay, I'm going to put your head forward just a little bit here, Vicki, to open those up. If you can scoot up in there just a tad. Now you can see she's got a little increased kyphosis right in through here. I'm going easy. Okay, good. Okay, I got another one right here, though. Oh, I feel it's in there. Okay, Tuffy, let go of it. There we go. Boy. You're making me work for it today, aren't you? Now this should actually feel even easier than the previous one.
Yes.
Good. So, I'm going to get kind of deep with Vicki's paraspinals today, so we're going to do the turbo nail. This is a very deep myofascial release instrument, as I'm sure Vicki will tell you here in a second. That's a lot meaner than Joseph, huh?
Absolutely.
And Joseph's much nicer and does a much more calming, soothing treatment. But he can get rough too. He got rough on me yesterday. There we go. There, okay. Yep. Okay, so I'm gonna be nice now.
Okay.
Everybody wants to know what we charge in here for our treatment. So we have different things that we do. We do decompression, manual spinal decompression, that's one fee. The adjustment of the full spine's another fee. Now, if you just did one or two areas, that's a different fee, but we never just do one or two areas because the entire spine and pelvis is always involved. So we adjust the entire spine and pelvis. We do therapeutic activities where we help the patient's tissues to remodel and relearn a movement or a stretch called neuromuscular re-education. Not unsimilar to how you would retrain a person who'd had a stroke to re-walk or to use their arms and hands to feed themselves again. In fact, we've got several patients coming in here right now in wheelchairs we're working on. And a lot of them don't want to be on videos because of some of the comments that are made, so try to keep your comments professional and nice and remember people's feelings because they do watch these videos as well. You can say anything you want about me and Joseph and Renee, but please have respect for our patients. And we do have the blinds open for y'all today. Some people like blinds open, some like them closed. I think you get a better picture actually when they're closed, but y'all been saying open, so we got them open. Now that should have felt pretty good there, Vicki.
That felt like heaven.
Yes. Okay, let's turn you on your back. Now you can see that curve's already gone down a little bit. And we're just going to keep chipping away at that. Okay, just lay you on your back for me.
Lay me on my back.
Yes, ma'am. There you go.
Feet?
Just like that, yep.
See, I'm thinking you're...
I'm going to pull your leg now.
Oh, that's right.
See, you can't get out of here without me pulling your leg and shooting you.
That's right.
There we go. Now you should have felt that in your knee and your back.
Yes.
Okay, and let's see here. There we go. Good. You feel that one in your knee and back as well?
I did.
Okay, let's stand you up here, or sit you up, I mean, face that away. Okay, so we're going to check your shoulders now. There you go. Boy, that was sounding awful like Renee's. There we go. Good. She's relaxing really well. That's it. Good. All right, good. All right, Vicki, would you mind sharing with our YouTube audience? You've been a chiropractic patient for years, right?
Yes,
Would you mind sharing with them what's different about this office compared to where you've been before?
The way Dr. Johnson adjusts me is totally different from any other chiropractor's office I've been to.
Decompression?
The decompression, I've never had that at another chiropractor's office, nor the way he adjusts on this table.
And we're getting our new table in hopefully later this week, so
Okay.
you'll even like that even better.
And he manually feels and can tell where you're out of alignment, and he knew things that were bothering me that I had not even told him about, just by the way my spine, the vertebrae were out of
And me
alignment.
palpating them and feeling them.
Right.
Yep. And that's, a lot of you ask, how do you know whether you got a good chiropractor or not? Well, if you go to a chiropractor and he palpates your spine and he doesn't tell you where it hurts, you have to ask you, does that hurt here or does that hurt there? You need to go find a different one that can find out where the person's out. Because really, once you become skilled at it, you can actually tell where somebody's misaligned and out of place, and you can tell where they're hurting and what kind of issues they're having. So, thank you for doing that. Let's shoot you now.
You're welcome.
Okay. See, we nice all our patients, but we pulled their legs and shoot them every time. Okay, let's flex you forward and backwards. Or some of them say we're nice to them. There we go. There we go. So, to get back to answering your question on how much it costs, a lot. But it's a lot cheaper than having back surgery or going through months and months of physical therapy that doesn't do any good. Good. Okay, now let's relax that again and try that one more time, please. This should feel smoother.
Yeah.
Take a look in the mirror right now. You're right down the middle everywhere. That's perfect. Plus your back, your curves are gone here now too. Very nice. How's that feel?
Much better.
Good. Okay, so this is your Houston chiropractor, Dr. Gregory Johnson and Vicki, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.